Good morning. Today we're going to talk about mistaken beliefs about relapse and how they can actually create a self-fulfilling prophecy that contributes to the relapse cycle. So looking at this chapter from Staying Sober by Gorski and Miller, I'm going to start out with what they say about mistaken beliefs and the role that they play in potential relapse for folks who are in recovery. They say many relapse-prone people believe that recovery is abstinence from alcohol and drug use, and relapse is the use of alcohol and drugs. So I'll stop right there. If you believe this, please listen further, because recovery is not just about abstinence from alcohol and drugs. Recovery is not just about abstinence from alcohol and drugs. So I'm going to read that again. Many relapse-prone people believe that recovery is abstinence from alcohol and drug use, and relapse is the use of alcohol and drugs. This leads them to believe that any time they abstain from alcohol and drugs, they are in recovery, and any time they return to alcohol and drug use, they are in relapse. As a result, they come to believe that not using alcohol and drugs is their primary task in recovery, which is not true. There is much more to recovery than just abstaining from alcohol and drugs. So let's read on about that. Recovery is not abstinence from alcohol and drug use. Abstinence from alcohol and drug use is only a prerequisite for recovery. I say this with such emphasis because it is super, super important. And this idea was drilled into my head when I was in residential rehabilitation for alcohol and drug use, that the prerequisite to recovering from addiction was not using alcohol and drugs, was staying sober, but that was not my primary task. So let's read on and hear more about what is the primary task of recovery. The actual recovery process involves completing a series of tasks daily that allow management of acute and post-acute withdrawal and the correction of the biopsychosocial damage caused by the addiction. In other words, recovery is a lot more than simply not using alcohol and drugs. If you believe that simply not using will produce recovery, you will be surprised at the dysfunction caused by the sobriety-based symptoms of addiction. You may also feel trapped and helpless because your mistaken beliefs keep you from finding a way to deal with these symptoms. Now, I have heard story after story after story of people who, in their addiction, were able to abstain from alcohol and drug use for a short period of time. Days, weeks, even months sometimes, without the intervention of any kind of program or recovery type of spiritual program. And those people are usually telling that as part of a story where they eventually began using alcohol and drugs dysfunctionally again. And the point of that is that just abstaining from alcohol and drug use for the addict does not place the addict back in control of their behavior and magically lift all of the symptoms of addiction and make everything all unicorns and rainbows. That's not the way it works. And recovery is about so much more than just not using. So let's, going on, they say, let us review this sequence of mistaken beliefs. Recovery, so the first mistaken belief is that recovery is abstinence from alcohol and drugs. The second mistaken belief is that relapse is alcohol and drug use. The third is that any time I abstain from alcohol and drugs, I am in recovery. The fourth is any time I return to alcohol and drug use, I am in relapse. And the fifth is, as long as I don't use alcohol and drugs, I will be in control of myself and my behavior. The mistaken conclusion that people come to as a result of this series of beliefs is relapse is always the result of a conscious and deliberate choice to use alcohol and drugs, and not using alcohol and drugs is my primary task in recovery. So, going on to explain a little bit about the fallacy behind that series of mistaken beliefs. They say the error is that not using, and let me say this another way that's a little more clear. The error is that abstinence from alcohol and drugs does not guarantee that you will be in control of yourself and automatically recover. Not using alcohol and drugs will break the addiction cycle and stop episodes of loss of control caused by intoxication. But as we discussed earlier, when the alcohol drug-based symptoms are interrupted by abstinence, they're replaced by sobriety-based symptoms. These sobriety-based symptoms can be so severe that they can cause you to lose control of your judgment and behavior even when sober. So the post-acute withdrawal syndrome, the symptoms caused by that, can be so severe that they can cause people to lose control even when they're abstaining from alcohol and drugs, if they're not managing it through a program of recovery. This is a really important concept for people in recovery to grasp, because when we talk to people who start to back off of their daily routine, their daily recovery routine, that's when we start to see a tendency toward relapse in a lot of addicts, is when people start to say, oh, things are going good. Maybe I don't need to do my meditation today. Maybe I don't need to go to that meeting this week. Maybe I don't need to talk to my sponsor. And all these things that they were doing that were helping them manage the sobriety-based symptoms of addiction start to fall off. And those sobriety-based symptoms of addiction come back, and here's what happens. Many alcoholics who relapse report that they become so dysfunctional in recovery that a return to addictive use seemed like a positive option. They were in so much pain that they started to believe that they only had 3 choices left: alcohol and drug use to medicate pain, suicide, or insanity. Well, if you have those 3 choices, which one are you going to choose? Given these options, the alcohol and drug use seemed like the best choice. So the final conclusion they come to: abstinence from alcohol and drug use is necessary for recovery, but is not the only goal in recovery. Learning how to live a meaningful and comfortable life without alcohol or drug use is the primary goal of recovery. Big difference there. Just abstaining from alcohol and drugs is not the goal of recovery. Learning how to live comfortably, learning how to cope with life on life's terms, that's the goal of recovery. And it takes more than just not using to do that. When I was smoking cigarettes, and I was a 1.5 to 2 pack a day smoker. And I used to tell myself, if I could just lock myself in a room away from these cigarettes for 2 weeks, then all of a sudden I'd magically lose the addiction. And it took me 15 years of trying to quit multiple various ways before I finally got to the point where I had some kind of click in my thinking, and I got to the point where I didn't need to smoke, but it required a totally different thought process than just abstinence from the cigarettes and getting away from the cigarettes. It required some serious work to do that, and so this is really important stuff. It is super important for us to realize that, one of our big goals in recovery is not to just abstain from alcohol and drugs, but to build a daily program that allows us to manage the sobriety-based symptoms of addiction. And that is where the daily work comes in. So I hope this has been valuable to some folks. There are more myths and misbeliefs about relapse that we will get into tomorrow. Really important to get this stuff down, because it is an important part of truly understanding what leads to relapse in recovery from addiction. Hope you all have a great day. I'll see you back here tomorrow.